Hi everybody, it's Monday the 5th of July and this is your third lesson for today, and we are looking at first aid, an introduction to first aid and getting help. We were meant to last week have people in called Start the Heart. We're looking at how we can perform first aid to help a casualty. So because we missed that, we're going to try and do it a little bit differently and give you some information, and then you produce a piece of work at the end. So we'll begin with just having a little think about these three questions. What does first aid mean? Have you seen one of these boxes below? And what do you think is in this first aid box? Have a little think about these different questions. What does that word first aid mean? Whereabouts? At home? At shops? Out on the street? In school? Where have you seen one of those boxes, and what do you think is in one of these first aid boxes? Pause the video and have a think. Well, first aid means giving aid to somebody and you're the first person to do it. So if somebody is injured, there's been an accident, somebody needs some help, you would be the first person to apply that help and give person what they need. You may have seen one of these boxes in school. We have them in different shapes around school. You might have one at home. When you go to the shops or anywhere else, you might have seen them. And some things that you might find inside a first aid box would be maybe things like plasters, wipes, bandages. You might find gloves. Lots of other things would be inside a first aid box. So let's get started and look at the next part. So we've got this question here. Who can be a first aider? And the answer is anyone can be a first aider. Okay, and today's lessons will help you to learn some important skills so that you can give injured people first aid. Now, you may have done this before, you may have never done it before, but if you're the first person and you think you can offer some aid, you can help somebody in a particular way, then that would make you a first aider. The role of a first aider is to keep yourself and the casualty safe. Stop anyone getting any further injuries. Quickly and safely treat any injuries. And get help from the emergency services if needed. And that word casualty at the bottom, which was in bold, means a person who is injured and needs help. So it says as well, stop anybody getting any further injuries and quickly and safely treat any injuries. So you might already know how to treat some, you might not, but not to worry if you don't. So an introduction to first aid. Sometimes you might feel nervous about doing first aid. You may have come across having to help a sibling or somebody at home or somebody at school and help them with first aid, or seen somebody do it themselves. Here are some important things to remember. Most importantly, you must stay safe. You must stay calm and keep talking to the casualty. These are three very important things. Also, if you need to, you should call 999 or 112 if it is an emergency. And above all, do your best. It's always better to do something small than to do nothing at all. That small thing you do, whether it's helping somebody with an injury, helping somebody by giving them something to make them feel more comfortable, or giving them something to drink, or giving them some encouraging words. A small thing that you do could make a big difference. So we're looking first at those three things we need to do. Staying safe. The most important thing in any first aid situation is staying safe. Who do you think is the most important person to keep safe? So if you come across an injury, you come across an accident, you see some people hurt, who do you think is the most important person to keep safe? And the answer is you. Keeping yourself safe is the most important thing. If you're hurt, how will you be able to help anybody else? So, how do we stay safe? The first and most important thing to do is to check the area is safe. Use your senses to check your surroundings. So if you enter a room or on a street or in your garden, you need to check if there is somebody injured. Is it safe for you to go and help that person? Or is there a risk that you might hurt yourself? So, using your senses, can you see anything that might be harmful to you? So looking at this image, it might be that there's petrol leaking from a car or loose cables. If you're in your garden, there might be something sticking out the ground or something has fallen that's sharp, that's high up, or using your eyes to check that the area is safe. Can you hear anything that could be dangerous? So if it was a car crash, like we can see this damaged car, it could be that the engine is still running and that might be dangerous. It might be something else, strange noises that might be coming from somewhere, maybe electrical or somewhere else. You can use your hearing to check for any dangers. Also, can you smell anything unusual that could be poisonous? You might smell smoke, you might smell something burning or anything else. Can you work out where that smell is? Is it going to be safe for you to approach the victim, the first person that needs first aid, or is there a risk to yourself? Does anything look like it may be hot or sharp if touched? For example, metal or broken glass from a broken window might be on the floor. So if so, do not touch it or let it touch the casualty. So we've got a picture here for you to have a look at and see. Staying safe. It says, look at this scene above. So we've got somebody's fallen over and damaged their knee, and they need first aid. But before you would go and administer first aid, you go and see if that person was okay. Can you spot any hazards in the image and explain why it could be a danger to a first aider? Think about what you could do to avoid the hazard or solve the problem without putting yourself in danger. So pause the video and have a look. If you wanted to help this person, looking around, what things could there be in the image that could actually injure you as well and you become a casualty too? Pause the video and have a look and a think. There are a few different things you might have spotted. Obviously there's lots of rubbish around and lots of things on the floor. Could be broken glass or metal. So if you went to help that person, you might end up injuring yourself as well. We can see that running across the road is a dog. And if we look carefully, I don't think that dog has a collar on, so we don't know if it has an owner. We don't know what type of dog it is, if it's a friendly dog or not, so it could end up biting or attacking us. And in the distance, we can see a car. There's a possibility that car might be turning and heading this way. So again, there are some other risks you might have thought of as well. Have a look at this image here. We've had an adult in the classroom seems to have fallen down. Can you spot the hazards that in the image and explain why it could be a danger to a first aider? And then can you think, what could you do to avoid the hazard or solve the problem without putting yourself in danger? Pause the video and have a look and a think. Well, first off, we can see by the injured person there's a pair of scissors. They could obviously cut us or they could cut the casualty, so we could move those away, including the string and the chair that we could maybe trip over. We could move those things carefully out the way. Also on the table we can see there looks like a hot drink, and again we don't want to knock that over or burn ourselves or the casualty, so again that could be moved to a safer place. And have a look at this image here. Looks like someone's very tired, has made themselves a hot drink and then poured it on themselves and burnt themselves. Have a look at the scene around you. What do you notice that could be a hazard to you or the casualty? And what could you do to stop anybody else getting hurt? Pause the video and have a careful look. Well, if we look, we can see by the cooker we might have something very hot cooking and the kettle's been boiling. So again, it might be over bubbling, so we might need to turn those things off. Maybe move them away from the hot surface so they cool down. We can also see by the plug there's a wire that we could trip over, but it also looks like some of the wire is exposed, and so we would need to make sure that nobody is electrocuted. And lastly, very important, we can also just see on the floor there is, by the drawers, looks like a big puddle of water. So again, we could slip on that water, or the casualty could, or we could even, which is more dangerous, with electricity being exposed, we could get an electric shock and again cause ourselves injury. So there's quite a few on there. And again, we would maybe move the wire, maybe switch off at the plug so there's no electricity running, or find a towel to clean up that wet puddle on the floor. Well done if you managed to spot those. So the next part about being a first aider is staying safe and then staying calm. Being faced with a situation where someone has been hurt can be upsetting or may cause you to panic. If you feel yourself starting to panic, take slow, deep breaths to calm yourself down. We've done lots of things about the staying calm and how we can keep our temper from not over boiling, and different ways we can help ourselves. So we could use those skills as well. After the casualty has been treated, this may be by yourself, or it may be that an ambulance came or somebody with more experience of first aid came and helped. You might have different emotions. You might feel happy and proud that you have done a good job. The little things that you did may have made a very big difference for the casualty. You might be confused because you don't really know whether you did the right thing or the wrong thing. You might feel angry. You might be angry with yourself, that you think maybe you could have done a better job or reacted quicker. You might be angry with other people because they didn't help the situation, or people didn't come quickly enough to help. You might feel sad or upset because you may feel that you might have done a better job, or you could have done something quicker. All these feelings are completely normal and fine. If you want to, you can talk to an adult you trust about what happened. They'll be able to help you and put your mind at rest. The last part is talking to the casualty, and this is very important. When you are in a situation which needs first aid, it is very important that you could communicate clearly with the casualty. When you are hurt, you may sometimes feel upset or confused. This is how your casualty could be feeling. Talking to them and explaining what is happening will help them to stay calm and feel reassured. Here are 3 key things to do when communicating with a casualty. The first one says act calmly. If the casualty sees you and you're not calm, you're panicking, you look worried about what's around you, you're not sure what to do, this could have an impact on the casualty and make the casualty start to panic. So if you're acting calmly, this will benefit the casualty and they will feel calm as well, knowing that they're in safe hands. Speaking clearly to your casualty is also very important. Telling them what you're doing is very important, again, to keep them calm. You may also have to speak clearly because you might be in a noisy building or a noisy street. There might be cars or people around shouting. It may be that the casualty has a problem with their ears perhaps, and they can't hear you, so you're speaking clearly to help them understand what you're doing. And as well, listen closely. As well as listening to the sounds around you, it may be very important to listen to the casualty. The casualty might be talking to you, giving you information you might need to know and tell other people from ambulance and medical services. It might be you're listening for a sound that they're making, whether they're breathing or not, or if they're making a sound that sounds rather strange. All these things that you can listen to, you might have to tell the people from the medical services if an ambulance is needed. even if your casualty does not respond. So you might have what's called an unconscious casualty, which means looks like they're sleeping but still breathing. You should still explain what you are doing. It will help you to remember what to do next, and it will let everyone involved know exactly what you are doing. And as well, it might help you remember what you did. People who are in the medical services, an ambulance might be called, and they might want to know what you've already done. So if you've talked about it, you'll remember easier and you'll be able to pass that information on. And the important thing is making sure that you're doing your best. Sometimes the casualty will need a lot more help than you are able to give. The best thing you can do is phone for emergency help. Which 2 telephone numbers can you ring if you need help in an emergency? Have a think. You can ring 999 or 112 in an emergency. What sort of information do you think you need to give if you ring 999? Have a little think. The operator who answers the phone will ask you specific questions, and they will be these 5 questions. Which emergency service do you require? So it would probably be ambulance, but the other options are police and fire. You might need to decide whether or not these are necessary services to come as well. They'll ask, what is your name? Where are you? What has happened? And how many people are hurt? All of this information will make it easier and quicker for the emergency services to get to you and the casualty so that they can give the help that's needed. And those few minutes that they can get there quicker by your information could make a big difference to the casualty. When you have answered these questions, stay on the phone. You can put the phone on loudspeaker if you need to. The operator will give you more information about how you can help the casualty. So let's see at what we've learnt. Let's see how much you've learnt about being a first aider and see if you can answer these questions. Who is the most important person to look after in a first aid situation? The most important person to look after in any first aid situation is yourself. What is the first thing you should do when you see someone who needs first aid? You should check the area for any dangers or hazards which could hurt you or the casualty. What should you do if you feel confused or upset after giving first aid? You can talk to an adult you trust and tell them about what happened and how you are feeling. If you need to phone the emergency services, what questions might the operator ask you? The operator will ask you which service you need, who you are, your location, and about the casualty's injuries. So here we have a picture here. What would you do if you saw this in your local town? What do you think you would need to do first? What would be the first things you would do? If you knew that some people needed first aid, what would you do to help in this situation? Think back to what you said you would do if you saw this scene in your local town. Would you change your mind at the start, or what is the first thing you think you would do? Well, we can see that we've got the car there, and it looks like it's got some petrol leaking out. So that's again something that we might need to worry. If the car is on or not, we might have to turn off the car. We'd have to check if there's anything that might hurt us in the area that we might be able to move out of the way of the casualty, or we might be able to move things out the way. We can ask people to help us who are walking in the streets. What other things did you think of? So here's your task for today. It's can you make a first aid poster from what you have learnt? Look back at the information and design an information leaflet or poster showing what you should do when you need to administer first aid. And if you want to, you can bring your finished posters to school and we can maybe put them around the school to inform other children about what they could do. So good luck with your task. Look forward to seeing your posters and we'll see you tomorrow. Take care. Bye-bye now.